Mabera police station, all those now, or maybe when we say Runjin Sambo, so they know where they will get those cases. So that is the summary of what he has just described for you to understand that how we do autopsy here, Sokoto and in Uduchi. He didn't mention some few examples. I just want to use 3 minutes to mention that there was a death that occurred around Guyo Eka. So the person has 2 wives. Then the relation says that he kills the other one because he loves the other wife than the other one. So he was held under the custody. So when we do the autopsy, we realize that this other one died of hypertensive heart disease, and she used some medication wrongly, which in one of the peripheral hospital the person is she is being treated for peptic ulcer, not for hypertension, because of the epigastric pain she's feeling. You know that it's just angina signs. So when we do the autopsy, so that autopsy now exonerates that man. So in other words, the pathologist can either exonerate you or implicate you. That's what we are saying, and that's the importance of autopsy. You either know whether someone is at fault or not. So my next presentation is just to say, okay, this is being underutilized, and I would like to go through this one. By history, the first recorded medical audit was done by Sani bin Thabit, a chief physician of the Baghdad, which is the market inspector. And this one is at the request of the Abyssinian Caliphate. After medical malpractice resulted in death of patient, then they start investigating that one since time immemorial. So following investigation, the first medical license examination has been introduced, and only physician who passed this exam can practice medicine. So we've seen since time immemorial the issue of this. So the next one is according to this book, if patient is cured, the physician is paid. If patient died, his parents go to chief doctor. They present this prescription written by the physician. And if the chief doctor judges that the physician has performed his job perfectly without negligence, he tells the parent that the death was natural. But if the judge find otherwise, then he will say that they have to take the money, blood money, for the negligence by this physician. So in this honorable way, they will be sure that medicine is practiced by experienced and well-trained personnel. So also, one of the earliest recorded history in the issue of audits in the clinical setting is by Florence Nightingale, which during the Crimean War, of course the nurses know her better than me. So she did that, and the mortality rate, when they are doing that, they realize that the mortality rate reduced because they are trying to find out whether you have done something right or wrong. So people will now stand and do their right thing. Autopsy are appropriately remunerated without compensation. Autopsy often not viewed as truly viable medical procedure. So what are some challenges of using autopsy? So in many cultures, autopsy are associated with death, grief, and leading to reluctance. What was it like in this environment? When things happen, people say, Allah, you don't need to even to follow up, of not knowing that there are some negligences in one point or the other one. Secondly, people thought that if you say autopsy, it's as if you are a butcher. You know, butcher will pieces the meat of animal. So when you talk of autopsy, people think you are piecing the body. The first presenter I mentioned to you that there were what you call limited autopsy. Limited autopsy, for example, we say, okay, in pediatrics, they have been coming with abdominal mass. We don't even know what is that one until the patient died. So all we are saying is we just open the abdomen only, inspect, take biopsy, and close. So that is all. It's not that we're open. That one is called limited autopsy, but limited to the abdomen. We can do, okay, only to the head. Or we can do limited autopsy, we do physical examination, especially in the case of accident, some gunshot and all those things. Like most of the military and other people, we don't open. They will say we do limited. And we indicate it to the coroner that we do limited autopsy. So that is what we are saying. So if we are doing that one, we'll be able to. There is a popular saying that you continue to take history for 1,000 years. The same thing. But when you open up today, once, you see the difference. So that's what we are telling the clinician, the colleagues. So the legal and ethical issue. Consent for autopsy involve complex legal and ethical consideration. Like, for example, he made mention of medical legal cases. Once people come with the autopsy, they say they want to do autopsy. They write to the CMD. The CMD now tell us we oblige. The next thing, when we tell them go and get the corona form, when they say where do you get the corona form, we say the police in that area. Once you call police now, people will say no, that's all, we will not do the autopsy again. So that is the issue of when we talk of legal and ethical issues. So that is why if the state resuscitate the corona services, that means the people don't need to go to the police. They will get the form from the corona office. That is all, and all need to be done. Everything will be done there without even paying a dime. And it's good to know that hospital-based autopsy, you are not paying a single kobo. It's as if as, okay, patient is admitted, then before doctor see the patient and I will say you have to pay me. No, it's part of his work. That is why for pathologists, hospital-based autopsy is free. Relation don't pay anything. But corona cases, you have to pay pathologist charges, excluding court appearance, because he show a form of what they call summon. When you do your autopsy as an expert witness, you have to go before the judge and defend that one. And that defense, you can do autopsy in Sokoto, you will be called to Port Harcourt to do the defense. And it's good for hospital to know that if pathologists do those autopsy, it's not the responsibility of the hospital to transport the pathologist there to do whatever it is. It is the pathologist himself. So in other words, if he did something, anything wrong, when they're going to arrest the pathologist and lock him, it's not the name of the hospital, it's not hospital responsible, his license. So that is why a pathologist will not, there are cases that he must make it clear. But of course, he must inform his employer, this is what he's doing because he do the autopsy in that hospital. But he is the one to defend the case, not the hospital lawyers to go and defend the case. You are on your own in that aspect. So